Hi, and thanks for joining us for Berger Beat, brought to you by Berger Health System and CGTV5. I'm your host, Kylene Vallone, and today we will be discussing Alzheimer's disease. I would like to welcome our two guests on the show today from the Central Ohio chapter of the Alzheimer's Association, Mary Danhauer and Greg Winslow. Mary is a licensed social worker and program director at the organization. She provides leadership and direction for the development, implementation, and evaluation of the programs and services at the organization. Greg is the interim executive director and is the top staff member of the organization. He also serves as the director of development and oversees all fundraising activities. Later on in the program, we will discuss their roles with the Alzheimer's Association and some of the services they provide, along with an event coming to Pickaway County. But let's start off talking about the actual disease itself. I know when thinking about Alzheimer's disease, a term that comes to mind is dementia. How are the two related, and is there a difference there?
There is a difference. When we use the term dementia, what we're talking about is a constellation of symptoms. We're talking about memory loss and confusion. And just like there's many types of cancer, there's many types of dementia. Alzheimer's disease is the most common type of irreversible dementia. There's also dementias, such as a vitamin deficiency, that can be reversible. So if your doctor is diagnosing you as demented, you need to get more information about what's causing that dementia, if it's something irreversible or something that could be reversed with the proper treatment.
Okay, how many individuals are living with Alzheimer's disease?
In the United States, there's about 5.3 million Americans living with the disease. In Central Ohio, we have about 24,000 people that are living with the disease.
Okay. What are some of the warning signs for Alzheimer's disease?
The very first warning sign that we see is a lack of initiative. And it almost looks like depression in the early stage. And it's very important when a loss of initiative is noticed to be evaluated by your family physician, because depression is high in the geriatric population, and depression could cause memory loss too. So lack of initiative is something we see. Short-term memory loss, not being able to remember what you had for lunch the day before. Usually in the beginning, people hold on to their long-term memory. So they can tell you in great detail something they did as a child, but not something that happened recently. You also see people that start to misplace items. Somebody may misplace their wallet. They honestly, because of the memory loss, forget where they placed the wallet, and they may start to accuse another family member of stealing the item. We see that. We also sometimes see people with problems with language. This is called expressive aphasia. So they may know the word they're trying to get out, but they can't retrieve that word in the same way anymore. They might get a description for an object. For example, they might say, I need that thing to clean my teeth. And you have to prompt them and say, oh, you mean the toothbrush? And they'll say, yes, the toothbrush. And a lot of times people do have awareness that they're having trouble with language, especially if they have a vascular dementia. Many times people with Alzheimer's disease don't have insight. So they may have no insight into that they're having these issues, although their family members are seeing these issues in the person.
Okay, and you mentioned the different stages of Alzheimer's. Mm-hmm. How many are there, and how does the person change through these different stages?
There's different models, and the stages, the models we have, are just to help give people an idea of what the progression may be. The stages can overlap. Some physicians use a 7-stage model. At the Alzheimer's Association, we use a 3-stage model: early, middle, and late stage. Usually somebody who becomes symptomatic and diagnosed with Alzheimer's, they live about 8 to 10 years on average. But one thing we always say, if you've seen one person with Alzheimer's, you've seen one person. Some people may live as little as 2 years, some people may live as long as 20 years. And some people have some difficult behaviors. Other people may just have the memory loss and the confusion.
Okay. What are some of the risk factors that are involved with Alzheimer's disease?
Age is definitely the #1 risk factor. 1 out of 10 people 65 and older have a diagnosis of Alzheimer's disease. About 50% of those 85 and older have the disease. Other risk factors, African Americans and Hispanics have a slightly increased risk over Caucasians. Obesity, high blood pressure, high cholesterol, and another warning sign or risk factor that many people don't realize is a head injury. Anybody who's had a head injury with a loss of consciousness is at risk factor, and we do see athletes such as former boxers getting dementia at a higher rate than the general population due to head injuries.
You mentioned that individuals can get the disease 65 and older. What about younger than 65? Is it?
Yes. There is a form of Alzheimer's disease where people under the age of 60 can get Alzheimer's disease. This is called early onset Alzheimer's disease, and it's more rare than the regular onset where symptoms appear after the age of 65. There's 3 genes that are involved with the early onset, so there's more of a genetic component than somebody who has family members that, for example, received a diagnosis in their 70s. If you have a parent or a sibling that's been diagnosed under the age of 60, you have a 50% increased risk of getting Alzheimer's disease. If you have somebody in your family, let's say your father who's 80 who gets Alzheimer's disease, you have maybe a 3 to 7% increased risk over somebody that doesn't have family history. So the good news is most people, if they do have Alzheimer's in the family, it's usually the kind that occurs after the age of 65. And there's a genetic component to that, but it's a lot less than the early onset form.
Okay. Are there treatments that are available for Alzheimer's?
Absolutely. And that's why if you notice any signs of memory loss or confusion, you should go to your family physician right away. The medications that we have work best the earlier that they are started. We have a class of drugs called anticholinesterase inhibitors, and the brand names for those are Aricept, Exelon, and Rimonel. And what these medications help to do is we have acetylcholine in our brain that helps us to form brain cells. And when you have a diagnosis of Alzheimer's disease, the brain cells actually start dying. And based on where they're dying in the brain, you can see different behaviors. Somebody that, for example, is having a complete personality change, that's due to these brain cells dying in the frontal lobe portion of the brain. So what these medications do is we can't increase the amount of acetylcholine we have in our brains, but we can use the medications as a stopper so that the acetylcholine isn't decreasing at as fast of rate. Usually the standard of care for Alzheimer's disease is one of the cholinesterase inhibitors along with another medication called Namenda. And Namenda is working on another neurotransmitter in the brain with the glucose in the brain. So what we want to see is we want to see these medications started together as early as possible. Now, these medications are not a cure, and families might not see an improvement, but what they really do is slow the progression a little bit. And if you take somebody off Aricept after a couple months because you think it's not working, a lot of times you're going to see a huge decline in the person. And when you restart the Aricept, they might become a little bit better, but they're not going to go up back to baseline where they were previously. So it's very important that people continue to take these medications throughout the disease process.